Operation Dudula took its protest against undocumented foreign nationals to the doorstep of the South African Human Rights Commission. Marchers assembled from the King Dinizulu Park in Durban to raise concerns about undocumented immigrants accessing healthcare facilities. The movement says its stance is clear. South Africans should be prioritized when receiving healthcare services.
Our march purposely, we demand the Human Rights Commissions to put South Africa first. As you know that Human Rights Commission, it's a form of the Constitution of Chapter 9. So in most instances where we see a Human Rights Commission, it mostly favors or it's mostly stands for immigrants, and there are cases of South Africans which Human Rights Commission failing to stand for.
Joined by members of March and March, Operation Dudula voiced concern over what it says is the SA Human Rights Commission's misinterpretation of Section 27 of the Constitution, which outlines the right of access to healthcare services.
And now we have a problem with the South African Human Rights Commission in terms of the misinterpretation they are doing. Because everyone, South Africa has got a right to access the health services. What we are saying, that everyone in that Section 27 is referring to the South African citizens, not the foreign national.
We feel that the South African Human Rights Commission is a unpatriotic NGO because they are fighting for the wrong side. They should be fighting for South Africans, not undocumented foreigners or foreigners per se. They should, if they want to fight for undocumented foreigners or foreigners, they should surely go to their country and go fight for them there. Here in South Africa, you need to fight for your South African citizens. We are rightfully here, and that is why we are trying to make a stand. We want government and all of these other MPOs or NGOs as per se, that is unpatriotic, to understand that we are tired and we are not going to stand for this anymore.
However, the Commission says everyone within the country has the right to access healthcare services regardless of nationality or legal status.
There's a course called interpretation of statutes, right? So all laws are subject to interpretation. They have their own interpretation, which is obviously different from other interpretations. They're entitled to that interpretation. We do not think we are interpreting the Constitution incorrectly. Our interpretation is correct. And as I said, obviously the demands they're making are aligned to an interpretation they're having, but we will in due course be able to give responses to the demand they're making based on those interpretations they're giving.
The Commission has been given 10 days to respond to the memorandum. For Newzroom Afrika on Channel 405, I am Silethiwe Ndlovu in Durban.